Alright, we're recording. Voice also.
So Dodger's a first-time patient for us, presented by his owner, Terry. We just finished rinsing his mouth, placing the dental speculum on him so that we can do a complete oral exam. Horses have 24 molars in the back of their mouth, and they've got a set of 6 incisors on the top and 6 incisors on the bottom in the front of the mouth. And depending on the gender of the horse and their genetics, they may have 0 to 4 canine teeth. Male horses have large canines. Mares will usually have no canines, or if they do, very small ones. And then, of course, when a horse is younger, they have wolf teeth coming in, which should be extracted if they're going to work for a living and wear a bit.
Here, look real close.
Cheryl, you can come up close and look, and then I'll go in there. You'll see the enamel points along the cheeks of the upper teeth, and the enamel points, it can come down a little bit for her, and the enamel points along the tongue side of the lower teeth. Those enamel points develop because the teeth do not perfectly meet between the uppers and the lowers, so the sharp edges develop where they do not wear. Down a little bit. Oh yeah, we're going to be able to help your fellow out. He's got hooks on these premolars right here, where my finger's pointing.
Yeah.
He's got all those points in the cheeks, down a little bit more. And he's got some ulcers in the back of his mouth. If you look where the dark pigmentation occurs at the very back, where my finger's pointing toward, you can see a dark spot. That's an example of an ulcer.
Okay.
Not to be confused with a piece of food I put on the end of my finger there. And we'll look at the other side now. Same issue. Although this, it looks like this hook popped off, or might have gotten knocked off just by the appearance of the end of that premolar. But you see all those sharp points in the cheeks. He really hasn't started to ulcerate in the back, but right here you can see where the points have been pinching him and causing abrasion and ulceration to the cheek.
Okay.
All right? So we'll get that all squared away for you. Let's see if we can see his canines. I don't know if you can see that or not with just this, Cheryl, but his canines are longish and sharp, so we'll just smooth the top of those. We don't reduce them too short. There's the canine on the top, up by the light.
I can see that.
Yep.
I hope it turns out on the video.
Yeah, well, we'll see. If it doesn't, it doesn't. All right, we'll get started on him since he's nicely sedated.